Today, we will be debunking myths of possibly the biggest hair transplant marketing scam. We'll discuss the comparison of DHI and FUE.
As you'll see, it's like comparing apples to oranges. In my opinion, these are examples of deceptive tactics that are used in hair transplant surgery marketing. What is DHI? Direct hair implantation. It refers to the recipient area, like the way that the grafts are actually placed. It has nothing to do with the donor area. It employs these implanter pens that are preloaded with grafts. This technique is coupling the site making to the placement of the grafts. So that is a coupled process with this technique. And usually they're manually placed into the recipient area by the surgeon. In contrast, other ways of placing the grafts make a recipient site first. That's the way that I do my hair transplants. We make the sites first, and then hair technicians, ideally very experienced ones, are placing the grafts then into these sites. Oftentimes, the surgeon myself will make all the sites, since that's the most critical part of the procedure, and then highly experienced technicians will place the hairs into the sites. What are the different types of DHI? Well, you've got implanter pens. The most popular would be the Choi type of pen. There are Keeps, which is another type of company, and then there are sharp and dull tips to that. So let me show you some version of a DHI method versus other types of ways to place hairs into the recipient area, just so you can see the different types of techniques and what I do, which you've seen already in my videos. But let me just kind of lay it all out here for all of you. These are a few options that one has to place hair into the recipient area. So these are needles, and there are different sizes that are used depending on the thickness of the hair, depending on how many hair grafts are there per follicle. So here are the options. You've got an 18 gauge needle, you've got a 19 gauge needle, and these are typically bent in a specific way to allow for you to figure out the depth that's needed, so that you're not going too shallow or too deep with the site creation. Another method is to use a sharp blade to make the site first and then use something like this. Well, actually there's two different types. These are called Keep, and these come from Turkey. One style has a blunt end here. See, it's not sharp. Putting my finger on it. You preload the graft into here, and then you, in a pre-made slit, place this in and then slide your graft off into the slit. They also make them sharp, so that essentially that's closest to an implanter pen and closest to what is being done when they say DHI or direct hair implantation. The tip here is sharp. Usually what's used is called a Choi pen. It has a little thing to click on the top, so you place it in, and then you click it to release the graft. But again, this requires multiple techs preloading the graft into the slit. And then the surgeon goes in, places it in, and then slides it down. Then you have implanters that look like this. This is interesting. This is by DeVroy. And what this has, I don't know if you can see, but this whole slit is actually open. So these are sharp. This whole slit is open, and you can fit up to like 5 grafts at a time. So basically you insert this into the recipient area and you slide one hair down into the slit, into wherever you inserted it. Then you go to the next spot, place it in, slide it down. Next spot, place it in, slide it down. This can work, but again, one of the challenges is that you need someone loading these up, like 5 grafts at a time, and they have to be good at that process and fast, because it can kind of slow you down. So this is another way to implant the hairs, and this also technically could be considered direct hair implantation. And then the method that I use is basically what you see here. You see blade handle or blade holder, and then you see the blade here. And we take the blade. This is actually a 0.6 millimeter. We have different sizes, but this happens to be a 0.6. We custom cut these depending on the size that we need to, again, fit the graft that we're working with. And usually we'll use a smaller one for hairline work, because that's where more of the singles go. And then as we get further back, we have it thicker for the larger hair graft. So you can see me placing this blade into the blade holder. And a couple of things to point out. First of all, I can angle it if I want. So yesterday I did an eyebrow hair transplant, for example, and so I used it at a pretty bent sort of angle in order to really be very acute to the skin surface. So that's kind of cool. But what really makes this great is that you can customize whatever you put in at the end there. And you see now it's locked, so it's holding the blade together. And you can go to some really acute angles. So if you're doing facial type of work with hair grafts, like for the beard or for the eyebrows, you want to be very acute. And this nice narrow handle gives you the ability to do that. The Choi pens and even these keeps tend to be a bit bulkier, and so it's hard to get into very acute type of angles. So that's one of the major advantages of the blade holder. So I make all of the sights, which lays like the framework for eventual graft placement by my technicians. So this is my preferred method, but as you can see, there are other methods, but this is what's meant by DHI, these two here, as opposed to pre-making sites with a needle or a blade and then putting the grafts into those sites. As you'll see as I debunk a lot of these myths that have been put out there by people looking to just sell hair transplants, you'll see that the purported benefits to DHI really aren't so magnificent. So the advantages of DHI, as far as I see it, are that the implantation is usually performed by the surgeon. And there's usually less bleeding, because every time you make one of those sites, you can sometimes spur up some bleeding. But in the case of DHI, you make the site and you put the graft right in. So that's a potential advantage. But now it's time to debunk the DHI myths that you guys see out there when you YouTube search something or Google search something. So please make sure to subscribe to our channel. You know we're giving it to you straight, and like this video. So claim number one, DHI is better than FUE. Well, FUE refers to the donor area extraction method, right? And it's really in contrast to FUT. You cannot compare DHI and FUE, because most of the times that people are doing DHI, they're also using FUE technique. DHI, once again, is referring to the recipient area placement method, right? In contrast to using blades and needles, as I just showed you, for site creation. So DHI couples the site creation with the placement of the grafts. There's no clinical study out there that shows improved hair transplant results if you use the DHI method over any other site making method. And needles have been shown to be equivalent to using blades. Essentially, it really doesn't matter what you use as long as you're doing it in the proper way, meaning the depth is correct, meaning the way that you handle the grafts is correct, and the angulation, direction, and density of what you're creating at the recipient area. That's what actually counts. Next claim, DHI uses special punches at the donor area. DHI has nothing to do with the donor area, right? There are many different punches and systems that are completely acceptable for extracting the FUE grafts and are also required for DHI as well. So saying that a DHI clinic has somehow special DHI extraction technology is BS. That doesn't hold up, because they're using the same type of things that everyone else uses to extract the grafts. Of course, there's user preference with extractions. As you guys know, I use the WA system personally, but there are many other good systems out there. Next claim, DHI graft survival is better, 90%. False. No clinical data shows the advantage of DHI over other implantation methods. FUE for scalp already has a greater than 90% survival rate when it's performed with the proper technique. Next claim, DHI offers a more accurate graft count than FUE. Again, one has nothing to do with the other. FUE is the method of choice for people who are doing DHI. And so the hair count is no different. You still need a hair count with your extraction method. It doesn't matter if you're doing DHI or not. So it has nothing to do with accuracy of graft counts. And the recipient sites are carefully counted when you're making the sites first, just in the same way as DHI sites are, because you're looking for a match between how many grafts you removed and how many grafts you need in your recipient area. Next claim, DHI controls the angle and direction better than other implantation techniques. Actually, a blade usually will allow for a flatter angle and more density than a DHI implanter pen. As I showed you earlier, the implanter pens tend to have more thickness to them. So even though the tip can be nice and fine, and you can control what kind of size you're using for the actual part that pierces the skin, but the body of the pen tends to be bigger, whereas the body of the blade holder is very slim. So I can create very sharp, very angled sights with the blade, and that's actually why it's my preference. DHI offers 100% safe and natural result. What? No technique or surgeon can ever guarantee anything 100% of the time, especially when you're talking about surgery. It doesn't matter if it's hair surgery or any other kind of surgery. There's no, as we say, no guarantees in life, right? So the same applies to surgery. Next claim. In other methods, the doctor's role is limited. There's a lot of variability here, and this all depends on the doctor involved in your case and the type of case that's being performed. There are some very unique cases that require maybe more of the doctor's involvement and others a little less, but again, it's all different depending on which clinic you go to. Some doctors will do all of their own FUE extractions. Others will outsource some of the extraction to skilled help. Most doctors who have any kind of reputable hair clinic will make their own recipient sites, and because this is the most important step of the whole process. But there are doctors who don't do anything as far as site creation. So it is true that most doctors, once the sites are created, if you're not doing a DHI method, will then not place grafts into the slits. That is true, and that is one real distinction with DHI. Though the implications on final results of procedures is a lot less clear when the overall team is an experienced team. Another claim, DHI is scar-free. Well, for the recipient area, all methods, if they're done properly, are essentially scar-free because there's a hair there. In the old school method with the plugs, and you're transferring these 4mm plugs, then yeah, that led to some scarring. So if you were to shave the head, you could see some scars. With the current techniques, regardless of DHI or any other placement method, usually the scarring is almost invisible. So if you shaved your head, you can't really see that there was a slit made because it's been replaced by a hair. And then as far as the donor area goes, all methods leave scars, right? If you're doing FUE, you get these little tiny dot scars. If you do FUT, you get a linear scar. But telling people that this is scar-free surgery is not being honest with the people. Another claim is that DHI creates more natural hairlines. False. The hairline is created with the artistry of the surgeon and how they see the hairline and what the patient actually wants and that type of collaborative effort. And when it's done well, the hairline can look very natural regardless of the implantation style. Some people, again, choose to use implanter pens. Some use the recipient blades. But all of them, if the actual site creation is done properly, can look very natural. Another claim is that DHI creates smaller recipient sites than FUE. Again, recipient sites with blades are routinely made to fit the size of the graft, and they go down to the same sizes as implanter pens. So again, a lot of these claims make no sense. Another claim, DHI is less traumatic on the grafts. This one's kind of interesting. So the use of implanter pens, right? Why isn't everyone using an implanter pen? Since there's less bleeding. I mean, that one's for sure. And so that is kind of nice. But why doesn't everyone use why don't I use implanter pens? The issue is that you require a really large team to do some of this work with implanter pens, because usually you have like 4 or 5 techs just loading up these implanter pens, or else the process is incredibly slow. And they essentially feed you the pen, you go in, you ask for another one. So you need many technicians to get it all kind of set up for you and get it into the pen for the doctor to then place it in. But that does leave room for techs mishandling the graft. So the same potential risks of graft mishandling, whether I make all the slits and then my techs come in and place the grafts, if they're not placing them well, of course that could traumatize the grafts and create unfavorable results. But same too goes for implanter pens. If you have techs that are loading up the pens and they're loading them up incorrectly and they're just being too rough with the grafts, then the stuff that you're putting into the hair inside your pen is going to be weak and potentially flawed and traumatized. So the key thing here is that you need a good team, a team that you trust. Whether that team is 2 people or 5 people or 10 people, each person is very important, and you're only as good as your weakest link.
You are the weakest link. Goodbye.
Right? So you can better control the process with fewer technicians than having a large team where people are coming and going, and you don't know if one person's maybe mishandling some grafts. And another reason why implanter pens are not as popular, and this relates to what I kind of just talked about, is that the labor costs are different. I mean, let's face it, like my cost to have really good technicians in New York City and pay them all for the procedures and keep the surgical price for patients still reasonable is a lot more challenging to do than in a place where cost of living is dramatically lower and people get paid less for their work. So those are very important, and that's not just New York City versus other countries, that's New York City versus some other states for sure, and other parts of New York even. So just all of these factors play into the ultimate decision to use something like implanter pens or not. At the end of it all the focus has to be on the patient, right? What's the best method at your disposal that will allow for the optimal results in your hands, in your clinic? That's how doctors should be thinking. That's how clinics should be thinking. And it shouldn't be about, selling some idea that isn't rooted in actual superiority over something else, and using it to just market and try to kind of fool people into a procedure. The last claim I have here is that DHI is the only method that can be done without shaving. No, all other recipient site options can be done without shaving at all. I generally don't shave the recipient area. So if I'm doing some hairline work or improving the frontal scalp, mid scalp, and the person already has hair in the vicinity, we generally work around that hair. Sometimes we shave it because the patients are open to that, but most of the time we are working around those long hairs. So it doesn't matter if you're using a needle or a blade or an implanter pen, you can work around long hair at the recipient area. Since you enjoyed this video on debunking DHI, you guys have been asking me for this video for a long time, please click on the card and check out our video to find out, did Elon Musk have hair transplants?